Welcome to EHS online courses. Today's video is on SDS Section 2 of Safety Data Sheet, Hazard Identification. The globally harmonized system of classification and labeling of chemicals contains a standard specification for safety data sheets. The SDS follows a 16-section format which is internationally agreed, and for substances especially, the SDS should be followed with an annex which contains the exposure scenarios of this particular substance. Section 2, Hazards Identification. 2.1. Classification of the substance or mixture. 2.2. Label elements. 2.3. Other hazards. This section identifies the hazards of the chemical presented on the SDS and the appropriate warning information associated with those hazards. The required information consists of the hazard classification of the chemical, e.g., flammable liquid, Category 1. Signal word. Hazard statements. Pictograms. The pictograms or hazard symbols may be presented as graphical reproductions of the symbols in black and white or be a description of the name of the symbol, e.g., skull and crossbones, flame. Precautionary statements. Description of any hazards not otherwise classified. For a mixture that contains an ingredients with unknown toxicity, a statement describing how much, percentage, of the mixture consists of ingredients with unknown acute toxicity. Please note that this is a total percentage of the mixture and not tied to the individual ingredients. Important terminology related to Section 02. Toxic. A small dose cause death or serious ill health when inhaled, swallowed or absorbed via the skin. Example: potassium cyanide, KCN. Harmful. A substance cause death or serious ill health when inhaled, swallowed or absorbed via the skin in large doses. Corrosive. Substance which destroy living tissues on contact, example: concentrated sodium hydroxide, NaO. Irritation. Substance which cause inflammation of the skin or mucous membrane, example: eyes and lungs, throat immediate prolonged or repeated contact, example: ozone O3. Carcinogen. Substance may cause cancer, abnormal growth of cells in the body, when inhaled, swallowed or absorbed via the skin, example: asbestos. Mutagen. Substance or agent may cause genetic mutations that can be inherited. Toxic to reproduction. Substance may cause sterility or affect an unborn child. Skin sensitizers. Substance may cause allergic dermatitis on contact with skin. Example: epoxy resin. Respiratory sensitizers. Substance can cause asthmas on inhalation into the lungs. Example: floor dust and isocyanates. What is chronic and acute effect? Chronic effect. An adverse effect on a human or animal body resulting from prolonged or repeated exposure with symptoms that develop slowly over a long period of time. Chronic effect referred to most are frequent are cancer, mesothelioma, silicosis, occupational hearing loss, cumulative trauma disorder. Acute effect. An adverse effect on a human or animal body resulting from a single exposure with symptoms developing almost immediately or shortly after exposure. Acute effect referred to most are frequent are irritation, rashes and dry skin, dermatitis, acute, corrosivity, burns or dissolved skin tissue, sensitization, allergic reactions, anaphylactic shock, metal fume fever, lethal concentration, LC. We will come with more educational EHS videos. Till then, thank you. Be safe.